You have now entered into the second trimester, and it's a beautiful time for you that your nausea and vomiting in the first trimester have finally gone away. Now you're more comfortable. Your baby has grown almost 100 grams and his weight would be 4 inches. Of course, you're looking pregnant now for the first time. You may have fatigue, your urinary frequency may be less, but constipation may have started, heartburn, indigestion, flatulence, occasional headache, fainting, nasal congestion. A lot of mood swings may occur, like excitement, finally the pregnancy is showing, or you can be forgetful. Pranayams in the 4th month of pregnancy. This is a very good time to do all the good pranayams. Enjoy the feel of the sun on your body, and in the sun, do a pranayam called as alternate nostril breathing. Take in the breath through the nose and out through the mouth. From the left side you expire, then in from the left and out through the mouth. This is called as Nadi Shodhan Pranayam or alternate nostril breathing. The second breathing is Zen breathing. Visualize a lot of positive energy entering into your body through your nostril. Hold it in this position 3 times. Take 3 breaths and then visualize whatever negative thoughts you have about pregnancy leaving your system, and you're getting purer and more happy after this process of pranayam. The second pranayam, third pranayam is Mahaprudra. You look at all the world around you and visualize how beautiful pran vayu you can get from the different places of the world. You probably start getting jitters now because your pregnancy is finally seen and the bump is known. You can start talking to your husband about this, attend antenatal classes, and this will increase your confidence. Maternity clothes will have to be started now. Often you'll see that you're putting on weight, your bump is increasing in size. It's a good idea to wear clothes with long vertical stripes and dark colors so that you can also look, your weight can be maintained. Now start on iron and calcium tablets, which also contain folic acid, and this will help you to maintain a good level. A slight sugar in your urine, a little vaginal discharge, all these things are to be watched out for. Keep the hygiene very good in these areas. Change all your garments at least twice a day. Starting an exercise regimen in the 4th month of pregnancy is also very important. Your fitness is related to the amount you can stretch, the amount you can stoop tall, and generally the feel of it in your whole body. So when you start your exercise in pregnancy, start in the 4th month with simple walks. You can go on a jogging track and try and walk how much ever you can. At least 20 minutes or 25 minutes of walking morning and evening is very important for your health. At this time, you can also start with the 4 types of walks, which is Shatapauli. In these walks, you will walk on your toes, you will walk on your heels, and you will walk on the outer border of the foot. For example, if you look at my feet, you will walk on the toes. This is to be done after food. 100 steps of walking on your toes. Then if you look at my feet, I am walking on the heels. About 100 steps of walking on the heels. And then walking on the outer border of the foot. This stimulates all the points required for digestion and also will give a good exercise and antenatal workout. So it's important to start all these exercises in pregnancy along with care of the different toxins. Whatever toxins may be in your home and office environment, try and avoid that as soon as possible. Clothes which are laundered using sulfur or benzene are to be avoided. Standing in front of the oven when the oven is on, it may leak some radiation which also should be avoided. So try and use less amount of toxin exposure for your baby. In the 4th month of pregnancy, you'll also like to check out maternity hospitals in your area. When you choose a maternity hospital, kindly read the chapter in our Garbhasanskar book, Choosing a Maternity Hospital. The most important criteria are all the equipment required for emergency methods for mother and child. Kindly look at all these issues available. Whether the hospital has a backup system if the child needs any NICU admission or any other problems. The other criteria may be the skill of the gynecologist, the pediatrician, the proximity to your house, the type of holistic labor things they encourage in the hospital, whether they will encourage you to do acupressure, labor massage, exercises, postures in their hospital. So think about all these things when you're checking out a maternity hospital for your delivery. Now, what are the other concerns you may have? You may have a tummy which is protruding, and you may have a navel which comes out. So this may be a little cause of concern to you. Remember, a tiny umbilical hernia in this stage is always normal, and it is okay to have a little tummy protruding out. You may also start noticing that that area is becoming very red. If so, you can apply a natural calamine lotion there, or you can apply little kokum water, or you can apply a moisturizing cream in that area. Now you may have difficulty sleeping. Insomnia is very, very common. Try and sleep with 3 pillows, one under the head, one under the tummy, and one under the legs. This will greatly help you and relax you. You'll often have insomnia because of leg cramps, frequent bathroom visits, a big belly. All these contribute to sleep. What can you do to try and ensure good sleep? Go to bed early. Exercise at night. Best is to take a walk, not a very heavy exercise. Avoid tea, coffee just before going off to sleep. Avoid any electronic gadgets in your bedroom. All the gizmos, all the electronic gadgets should be done in another room and not on your bed. So you associate your bed only with relaxation. Light an aromatherapy lavender lamp. Have a nice hot water bath with water. Have fresh air circulation in the room. Sleep with 3 pillows. Have warm milk at night. It's soothing and it has serotonin. And do not have your dinner at least 2 hours before you sleep. 4th month of pregnancy. Tips for fathers to be. You can get a detailed information if you join an antenatal or Garbhasanskar class together. Your complaints in your pregnancy, how you can support her, how you can be a good labor partner. All these will be taught to you in the class. Not only antenatal topics, but even postnatal topics like baby care, baby massage, all these will be taught to you. You talk to your partner about what support she expects from you in labor. Keep a watch on her diet plan, especially the 6:30 PM fluids which I have told you, and also the salads and the fruits which she is eating. Remind her about yoga, do pranayam with her. Daily do 25 minutes of Garbhasanskar as taught in the pregnancy classes. Remain unfazed and solve common domestic issues with a smile. Simple things like the maid not coming, house cleanliness, lot of guests coming at home. If you have an older sibling, prepare the child psychologically for the pregnancy to come. Learn the massage and acupressure points, and also learn the touch therapy to relieve her of her common complaints. I am sure if you can perform these roles, your wife will always remember what a great support you've been to her, not only in pregnancy but also in labor.